So epilepsy awareness is important for a few very intuitive reasons. What happens is, in our society, epilepsy is still a huge taboo. You all are very young, but when we were growing up, if somebody had cancer or if somebody had tuberculosis, people would talk about it in very hushed tones. Usko na TB hai, usko TB hai, uske ghar mat jana, kind of a thing. It was a big social stigma. Um, is my Can you still hear me?
Yeah.
Is Apoorva frozen? Okay. So I was wondering, is it my connection? Okay. So uh, so anytime, whichever disease it is that you're talking about, if there is a stigma around it, it stops people from recognizing it. Even if they've recognized it, because it's a social stigma, people don't go and get treatment for it. So especially when it comes to kids or say women, then they keep thinking ki, because the whole family talks about them in very hushed tones. They tell them किसी को बताना नहीं है, तो मुझे ये होता है करके. They think कि there is something wrong with me. I have brought shame to the family. So they grow up, or they develop a lot of inferiority complexes, and then a lot of psychological issues. They may not get diagnosed, forget treated. So it's a huge safety hazard. What we see in the villages especially is women who have epilepsy, they don't get, it's not talked about, it's not treated. पूरा दिन चूल्हे के बाजू में बैठी हुई रहती है. They get a seizure, they lose consciousness, they fall on the chulha, they get terrible burns, which can even be life threatening. And if not life threatening, the disfigurement is yours for the rest of your life. So just because you don't talk about epilepsy, the cascade of events that follow, and it's honestly, it's not just epilepsy, it's take any disease. If you don't talk about it, if you don't remove the stigma around it, patients are not going to get the treatment they need. They're not going to get correctly diagnosed. Especially with epilepsy, it causes a lot of issues with patient safety. It can even be life threatening, an undiagnosed, untreated epilepsy. And why? I mean, we live in an age where everybody talks about iPhone 10 and driverless cars, and then you can't get a simple medicine to control people's seizures. Just sounds very wrong. The other problem that happens at a larger level is that if there is no talk around epilepsy, as a society, as a community, as a country, no research gets done, no public health studies get done. No, but so India is a classic example. Apoorva had messaged me saying, India ke epilepsy statistics bata do. कहाँ से बताऊं? There are hardly any public health studies which are large scale. There are district level studies, but there aren't any state level, region based studies which tell us what is the incidence of epilepsy in India, what are the most commonest causes of epilepsy in India. This is, all of us have a good idea about it, but do I have statistics to prove it? Or are our ideas wrong? What our ideas come from what we see in practice. But you need solid statistics to back anything. If you want to take it to a public health level, if you really want to make an improvement, where the work starts is at a statistical level. So the minute it's a stigma, not much gets done about it. Research nahi hota hai, funding nahi aata hai. So that whole vertical growth also is really hampered. So where I'm coming from is what I'm passionate. Yes, I'm passionate about epilepsy, but even more passionate about epilepsy surgery, which is a curative treatment method for a select number of patients. But and I've trained in UK, so there's such a big cultural difference when it comes to epilepsy surgery. Forget epilepsy. So if in UK, we would have people begging, saying, please get me on that list of epilepsy surgery. Please get me into the evaluation. Please see if you can operate my child and improve him or her. And here they can, I am saying to my one of my patient families, saying ki Baba, epilepsy surgery is the option for your child and it's curative. Nikal jayega epilepsy, baat khatam. You move on with your life after it. I have so many families saying, Madam, वो surgery छोड़ के ना और कुछ भी आप और एक दवा लिख दीजिए. Like no surgery नहीं करा surgery. I'm like, why? नहीं वो brain का epilepsy surgery, this that. So complete misunderstandings, lot of myths around it. science is, the medical science is same, the problems that the patients face are same, the way we treat it, if I sit in Mumbai or I sit in Timbuktu, the medicine around it doesn't change. But the people's reactions also cause a lot of issues in being able to deliver the appropriate care, but then whether it's to a given patient or a larger subsection of patients. So my God, there's so many reasons why the stigma should go away. We should have more awareness. And I'm hoping one day somebody like Amitabh Bachchan starts talking about epilepsy, how he talks about TB right now. We need big ticket,
Movies.
talk about epilepsy for it to happen.